Mabuhay Madayaw! My name is XLKAND REMONTAL from BSN. I'm gonna tackle today the parasite called Dipylidium caninum in microbiology and parasitology. What is Dipylidium caninum? Dipylidium caninum, also called the flea tapeworm, double-pored tapeworm, or cucumber tapeworm, in reference to the shape of its cucumber seeds like proglottids. Through this also resemble grains of rice or sesame seeds. It's a cyclophilid cystode that infects organisms afflicted with fleas and canine chewing lice, including dogs, cats, and sometimes humans pet owners, especially children. Adult morphology. The adult morphology is about 18 inches to 46 centimeter long. Gravid proglottids containing the worm's microscopic eggs are either passed in the definitive host feces or may leave their host spontaneously and are then ingested by microscopic. Adult morphology. Flea larvae, the intermediate host in the surrounding environment, as in all members of the family of Dipylididae, proglottids of the adult worm have genital pores on both sides, hence the name of double-pore tapeworm. Each side has a set of male and female reproductive organs. The uterus is paired with 16 to 20 radial branches each. Adult morphology. The scalex has retractable rostilium with the 4 rows of hooks, along with the 4 suckers that all cyclophilid cestodes have. Adult worm scalex is rhomboidal in shape with a transverse diameter of 250 to 500 um. This is the life cycle of the parasite. First, the gravid segments and egg packets through flea larva with cysticercoid, through adult flea with cysticercoid, through adult dog or cat, through 2 to 3 weeks. The life cycle. The definitive host within this life cycle is primarily canines and occasionally felines, and in rare cases, young children. The intermediate host includes fleas and chewing lice. The first stage in the life cycle is when the gravid proglottids are either passed through fecal matter or actively crawl out of the anus of the host. The gravid proglottids, once out of the definitive host, release eggs, then an intermediate host. The life cycle. The gravid proglottids, once out of the definitive host, release eggs. Then, under intermediate host, the larval stage of flea or chewing louse will ingest an egg, which develops into cysticercoid larva. The cysticercoid larva remains viable, but is not effective to the carnivores until the flea hatches to an adult and begins feeding on a host. Approximately 36 hours after the flea has consumed a blood meal. The infected metacestodes develop inside the flea. The metacystode's larva must be ingested in a flea by a dog or cat during grooming in order to develop. Humans can also become infected by the Dipylidium caninum by accidentally ingested an infected flea. In the small intestine of the definitive host, the metacystodes develop into an adult tapeworm, which reaches maturity to 4 to 6 weeks after ingestion. This adult tapeworm produces proglottids and over time.
Human infection. A human infection with the Dipylidium caninum is rare, but if an infection does occur, it is more likely to occur in young children. As of early 1960s, the number of cases of the Dipylidium caninum in the US was a mere 21. Therefore, human infection of the Dipylidium caninum or the Diphylisis diasis is a rare occasion. It is largely agreed across the parasitology community that despite the reports of this disease occurring, there are very likely numerous cases that have gone unnoticed and unreported because of its subtle and minor pathology in humans. In addition to its scariness in clinical records, the adult tapeworm grows within the host for 3 to 4 weeks after initial infection. The number of parasites that host is initially infected with is directly related to the number of cysticercoid juveniles present in flea's column. The load of parasites present in the humans is lower locally. Treatment and prevention. As with host tapeworm infections, the drugs of choice to kill adult tapeworms are praziquantel or niclosamide. Pets can be prevented from becoming infested with tapeworm if they are treated prophylactically with a product which kills the intermediate host, which is the flea, before the infected metacestode can develop. Some isozoline products are registered to prevent flea tapeworm. Diagnosis. Single gravid segments or more rarely multiple segments or whole tapeworms can be detected in pet feces, usually by the owner. The gravid segments of the Dipylidium caninum look like cucumber seeds. Detecting of egg packets on fecal flotation is uncommon, as primarily segments are shed in feces and the egg packets are large and less likely to float. Each egg packet measures up to 200 diameters and contains up to approximately 30 eggs. If you are lucky enough to detect egg packets of the Dipylidium caninum on flotation, they are quite distinctive, although if their size is not fully appreciated, they are sometimes misidentified as hookworm eggs. If the adult tapeworm's segments recovered from feces stems dehydrated, immersion in tap water for several minutes will often reveal the diagnostic structures, most notable the bilateral genital pores. This is the picture of Dipylidium caninum example parasite. Geographical distribution. Dipylidium caninum is found worldwide and is the one of the most common tapeworms infecting dogs and cats. Its prevalence is higher in areas with warmer climates and where flea infestations are common. Life cycle in humans. If a human accidentally ingests an infected flea, the larvae can develop into adult tapeworms in the intestine. Symptoms in humans may include abnormal discomfort, diarrhea, and its itching around the anus. Diagnosis and treatments in humans are similar to those in pets. Public health importance. Although the Dipylidium caninum infection in humans are usually mild and easily treatable, it underscores the importance of regular deworming and flea control for pets. Additionally, maintaining good hygiene practices, especially hand washing after handling pets, can help prevent transmission to humans. Environmental persistence. Dipylidium caninum eggs are resistant to desiccation, can survive for several weeks to months in the environment under suitable conditions. This resilience allows for potential reinfection of pets when they are in just infected fleas or contaminated environments. That's it. Thank you for listening. Once again, this is XLKAND REMONTAL. Hope that you have learned about the parasite called Dipylidium caninum.